Oxycodone in bodybuilding, potent opioid, pain management, and hidden dangers. Introduction. Oxycodone, a powerful semi-synthetic opioid often prescribed for moderate to severe pain. In hospitals, it's a mainstay for post-surgical recovery, cancer patients, and trauma victims. But in the bodybuilding world, oxycodone has a shadowy reputation. Some athletes turn to it for pain suppression, training through injuries, or psychological relief. Today, we will explore how oxycodone works in the body, why bodybuilders use it, the benefits they perceive, and the serious health risks that come with misuse. Biochemistry. How oxycodone works. Oxycodone is a semi-synthetic opioid derived from thebaine, an opium alkaloid. Mechanism of action. Mu-opioid receptor agonist binds to brain and spinal cord receptors to block pain signals. Kappa and delta receptor effects contribute to analgesia and mild euphoria. Effects on the central nervous system. Reduces perception of pain, increases dopamine in the mesolimbic pathway to create euphoria and reinforcement, sedates the CNS to reduce stress and anxiety temporarily. Pharmacokinetics. Oral bioavailability, 60 to 87%. Half-life, 3 to 6 hours immediate release, 8 to 12 hours extended release. Metabolized primarily in the liver via CYPA34 and CYP2D6, producing active metabolites, oxymorphone. Why bodybuilders use oxycodone? Pain management. Heavy lifting and extreme training cycles often cause joint pain, tendinitis, and microtraumas. Oxycodone suppresses pain so effectively that lifters can continue pushing through injuries. Post-injury or post-surgery. After shoulder, knee, or back surgery, oxycodone can maintain training consistency. Misuse occurs when athletes extend use beyond medical necessity. Anxiety and sleep aid during contest prep. Extremely low calories, high cardio, and pre-contest stress lead to insomnia, irritability, and anxiety. Oxycodone's sedative effects provide temporary relief and help athletes sleep. Appetite modulation. Opioids often reduce appetite, which may be seen as a tool during cutting phases. Some athletes exploit this for rapid fat loss, though it's significant health risk. Perceived performance enhancement. Not anabolic, it does not increase muscle growth. The perceived benefit, masking pain, more volume in training, indirect short-term performance advantage. Dosage in bodybuilding versus medical use. Prescription-only medication. Misuse can be deadly. Medical doses. Immediate release 5 to 15 milligrams every 4 to 6 hours. Extended release 10 to 80 milligrams once every 12 hours. Bodybuilding misuse patterns. Pre-workout, higher doses to push through pain. Post-workout, as sedative for recovery or sleep. Abuse risk. Taking multiple pills in a day beyond safe limits. Rapid tolerance, dependence, and overdose risk. Physical and psychological risks. Physical risks. Addiction and dependence. Oxycodone has high abuse potential with rapid development of tolerance. Withdrawal symptoms, sweating, cramps, insomnia, anxiety, nausea, and vomiting. Hormonal disruption. Chronic opioid use suppresses GnRH, LH, FSH, low testosterone. Effects: reduced muscle growth, libido, energy, and recovery. Respiratory depression. Dangerous when combined with alcohol, benzodiazepines, or sedatives. Can lead to coma or death, especially in non-tolerant individuals. Gastrointestinal issues: constipation, nausea, vomiting, abdominal pain. Risk of bowel obstruction in chronic users. Cardiovascular and liver risks. Chronic use can increase heart strain indirectly by promoting inactivity or poor nutrition. Hepatic metabolism, CYPA 450, liver stress, especially with other drugs or supplements. Psychological risks: euphoria, addiction spiral. The brain's reward system is hijacked, so strong psychological dependence. Mood disturbances: depression, irritability, anxiety increase with long-term use or withdrawal. Cognitive impairment: reduced focus, slower reaction time, dangerous in heavy lifting and training. Sleep disruption: despite sedative effect, opioids disrupt REM sleep and long-term recovery. Interactions with bodybuilding drugs: steroids compounded testosterone suppression. Clenbuterol or T3, high cardiovascular risk, opioids blunt respiratory response. Stimulants: Adderall, Vyvanse, risk of seizures and heart strain. NSAIDs, GI bleeding risk increases. Statistics: Oxycodone is 10 to 20 times more potent than codeine orally. Studies indicate opioid-induced hypogonadism in 50 to 80% of chronic users. Overdose risk: 1 in 20 recreational users suffer life-threatening events within 6 months of misuse. In athletes, pain masking contributes to long-term musculoskeletal damage. Final warning: oxycodone may feel like a powerful ally for training through pain, improving sleep, or coping with contest stress. But in bodybuilding, it's a trap disguised as a tool. It masks injuries, suppresses hormones, damages organs, and creates life-threatening addiction. There is no anabolic benefit. The only real advantage is temporary pain relief, and even that comes at a potentially catastrophic cost. Recovery, physiotherapy, proper programming, and medical supervision are the only safe ways to manage pain in bodybuilding. Oxycodone is not part of a healthy path.